you're over 70, you've probably been told to keep up with regular checkups to stay safe, stay ahead, and stay healthy. But here's what no one tells you. Some of those very same tests might actually put you at more risk than skipping them altogether. Let that sink in for a moment. Because while the intention is good, the reality is this. Not every test is worth the cost, stress, or danger, especially as your body changes with age. From unnecessary exposure to radiation, to false positives that lead to painful treatments you may never have needed, to procedures that do more harm than help. This video is not about fear, it's about informed choices. Because real health isn't about doing everything, it's about doing what's right for you. So let's talk about the 5 common checkups doctors now say seniors should avoid after 70, unless absolutely necessary, and what you should consider instead. Let's start with one of the most common and controversial tests for seniors, the colonoscopy. Now, don't get us wrong. Colonoscopies save lives, but after age 70, the risks can outweigh the benefits for many older adults. Here's why. The test requires anesthesia, which carries increased risk of confusion, memory problems, and even delirium in seniors. The preparation, days of fasting, and strong laxatives can cause dehydration, electrolyte imbalances, and dangerous drops in blood pressure. And worst of all, invasive testing like this can lead to unnecessary follow-up procedures for slow-growing polyps that may never become dangerous in your lifetime. A study published in JAMA Internal Medicine found that many seniors are being overscreened, leading to complications without real benefit. So what should you do? Talk to your doctor about your overall risk level. If you've had clear screenings before and you're over 70 or 75, it may be time to stop. Ask whether a less invasive screening, like a stool-based test, is a safer alternative. You go in for a scan, maybe for your chest, your abdomen, or to check on a long-term issue. The technician says, "We're going to use contrast dye so we can get a clearer image." Sounds simple, right? But for seniors, this routine step can quietly trigger a serious health issue. The contrast dye used in CT scans, particularly iodine-based dye, puts stress on your kidneys. And after age 70, your kidneys may already be less efficient at filtering waste and toxins. Even if your blood work looks normal, older kidneys often have reduced reserve capacity, meaning they can't handle the same load they used to. The result? In some cases, seniors experience contrast-induced nephropathy, a rapid decline in kidney function after the scan. It can lead to fatigue, swelling, trouble urinating, and in severe cases, hospitalization. And the worst part? Many of these scans are not even necessary. A 2020 review from the American College of Radiology found that thousands of seniors undergo unnecessary contrast-enhanced scans each year, when non-contrast imaging would have been safer and sufficient. What should you do instead? Always ask, is this scan absolutely necessary? And can it be done without contrast? Get your kidney function tested before any contrast scan, especially if you're over 70 or have high blood pressure or diabetes. This one is especially important for senior men, the PSA blood test for prostate cancer. It's been widely used for decades. It sounds responsible, safe. But after age 70, the reality is more complicated and potentially harmful. Here's the issue. The PSA test measures a protein in the blood linked to prostate activity. But that number can rise for many harmless reasons, not just cancer. And when the number is slightly elevated, what happens? Biopsies, surgeries, radiation, and intense hormone treatments for cancers that may never have caused symptoms in your lifetime. In fact, the U.S. Preventive Services Task Force recommends against routine PSA screening for men over 70 because studies show most prostate cancers in older men are slow-growing. Treatment side effects, like incontinence and impotence, can lower quality of life, and many men treated aggressively may not have needed it at all. This is what doctors call overdiagnosis, detecting a problem that was never going to harm you. So what should seniors do? If you're over 70 and feeling well, you may not need PSA testing anymore. Discuss your personal risk, symptoms, and family history with your doctor. Don't let one number dictate your path, especially if there are no symptoms. You care about your heart. Of course you do. And maybe you've been offered a coronary calcium scan to check for buildup in your arteries. Sounds like a good idea, right? But if you're over 70, and especially if you're already managing your heart health, this scan might do more harm than good. Here's why. A coronary calcium scan uses a CT machine to look for calcium deposits in your arteries, a sign of potential heart disease. But calcium buildup is common with age, and not all buildup is dangerous. The scan often leads to anxiety and a cascade of more invasive tests, even if you're symptom-free. Many seniors who take the test end up with stress tests, angiograms, or even unnecessary stents or medications, all because of a number, not symptoms. It exposes you to radiation, something you might want to limit after 70. The American College of Cardiology recommends this scan primarily for middle-aged adults at uncertain risk, not for healthy seniors who are already on a treatment plan or managing their blood pressure and cholesterol. So what should seniors do? If you've already been diagnosed with heart disease or are taking medications, this scan won't change your treatment. If you're symptom-free and over 70, focus on lifestyle, movement, blood pressure, and diet. Always ask, will this test change how we treat my heart? If the answer is no, it might not be worth it. Let's talk about a test most seniors, especially women, are encouraged to take. The bone density scan, also known as a DEXA scan. It's used to detect osteoporosis and measure your fracture risk. That sounds important, right? And it can be. But here's the problem. After age 70, repeating this test every year or even every 2 years might be a waste of time for many people. Why? Bone loss happens slowly. Frequent scans often show very little change, even over 5 years. And the results can lead to overtreatment with medications that come with serious side effects like jaw decay or digestive issues. According to a study published in the New England Journal of Medicine, many seniors with stable bone density were given medications they didn't need, based on a number that hadn't changed. And here's something few people know. Some of the treatments for osteoporosis are only effective for specific types of bone loss, not all. So blindly treating the scan result might not even help you. So what should you do? If you're over 70 and have no major change in health or fracture history, spacing your scans out to every 5 years may be enough. Focus more on fall prevention, balance, vitamin D, and weight-bearing exercise. Those protect you better than numbers on a screen. Talk to your doctor about whether your scan results will actually change your treatment. Now that we've covered the 5 checkups that may cause more harm than help, let's shift to something just as important: knowing what to ask before saying yes to any test. Because here's the truth. Most unnecessary medical procedures start with good intentions and no questions. So before you agree to any test, scan, or screening, especially after 70, ask your doctor these 3 simple but powerful questions. Question 1. Will this test actually change how we treat me? If the answer is no, if your care won't change based on the result, then why take the risk? Question 2. What are the risks of doing and not doing this test? Every test carries some risk, and sometimes not testing is safer. You deserve to know both sides. Question 3. Are there safer alternatives? Could you do a less invasive version? Could you monitor instead of act immediately? These questions put you back in control. Because medicine shouldn't be about doing more, it should be about doing what matters. You've probably heard the phrase, better safe than sorry. But in modern medicine, that thinking has a dark side, and it's called overdiagnosis. Overdiagnosis means finding a condition that would have never caused harm in your lifetime, and it's surprisingly common in people over 70. Here's how it happens. A routine scan finds a small nodule or abnormality. It's flagged as suspicious, even though it might never grow or spread. Suddenly, you're in a spiral of follow-up tests, biopsies, and treatments, all for something that may never have needed treatment in the first place. This leads to stress, side effects, and sometimes irreversible decisions. Seniors are especially at risk because the body naturally develops benign growths as it ages. Certain cancers grow so slowly they'd never cause issues during your lifetime. And most screenings aren't built to account for life expectancy or quality of life. What should you do? Ask your doctor if the condition found is clinically significant or just statistically visible. Request a watch and wait approach if there's no urgency. Don't let fear push you into fast decisions, especially with vague or borderline results. Believe it or not, many health checkups are ordered not because they're truly needed, but because they've always been done that way. It's a pattern in healthcare called clinical inertia. In other words, doctors and clinics keep doing the same tests year after year without fully questioning whether they're still helpful, especially for seniors. Here's a common example. You turn 75, and your annual reminder says it's time for your routine screening, even though your last few results were perfect. Why? Because the system is automated to recommend it, not because your body needs it anymore. And guess what? Many doctors are under pressure to follow guidelines or face penalties from insurance systems. That means sometimes they may suggest tests just to check a box, not because they truly believe it'll benefit you. What can you do? At your next visit, ask, is this test based on my history or just routine? Push for personalized care, not one-size-fits-all medicine. Remind your doctor that your priority is quality of life, not quantity of tests. When we think of side effects, we usually think of medications. But tests and screenings can come with their own side effects too, and they're rarely discussed. Let's break this down. Every test, from blood work to imaging, can have physical, emotional, and financial consequences, especially for seniors. Physical risks. Some procedures carry infection risk, like biopsies. Others may lead to falls or weakness from fasting, anesthesia, or dehydration. Imaging tests expose you to radiation, which adds up over time. Emotional risks. A vague or uncertain result can trigger anxiety, insomnia, or fear. Waiting weeks for follow-up results can cause unnecessary stress. Some seniors even experience depression from being labeled with conditions they don't feel or understand. Financial risks. Tests often lead to more tests, which may not be fully covered by insurance. You might face surprise bills for procedures you didn't expect. And unnecessary testing can quickly become a financial burden on fixed incomes. So how can you protect yourself? Always ask, what are the risks and downsides of this test beyond just the result? Don't be afraid to say, let me think about it, or get a second opinion. Remember, doing less can sometimes be the smarter, safer choice.